In city like Bengaluru, where do people go? What do you do when you want to have leisure time with your family? You go to a mall. So why not take care of healthcare there itself? So we want to be the healthcare hub wherein you just show up and you will be taken care of. We brought in an MRI machine in a running mall. That is the first time that has happened in the world. Individualized medicine is where we are headed. Going forward, it will design a pill that is based on your body weight, your vitals, and that it will deliver to you.
Healthcare is something that we often end up overlooking. Sometimes it's intimidating, sometimes it's just scary. But we kind of push going to a hospital unless it's absolutely necessary. But today there's something as simple as going to a mall and figuring out how to deal with your issues at a hospital which is inside a mall. Today we have with us Deepak Marda, who is the founder of MardaMed. Welcome to the Deccan Herald podcast, sir.
Great to be here.
How did the idea of MardaMed come to you?
The idea behind MardaMed is very simple. It came to me as I was visiting my dad, who is a doctor, practices in a small town on the border of Maharashtra, Karnataka. And as I grew up in a doctor family, the front part of our house was a clinic and the backside was our living area. I got to see how a doctor family goes through, what it goes through, what sacrifices it takes for a doctor to give that service. And at the same time, I saw the anxiety that patients go through. And these stressful times are what cause excuses that push us or that make us postpone taking care of our health. And my goal is to reduce that stress, reduce that anxiety, reduce the friction that makes us postpone taking care of our health. Because even in my close family, in spite of having so many doctors in the family, I have had 2 aunts that I lost to breast cancer. And in today's day and age, that just shouldn't happen. And that's how the idea about MardaMed came.
You said your father is a doctor and you're surrounded with doctors in your family, but you followed a different path. How did that happen?
Yes. So I'm an engineer and I have worked in technology, but then somehow destiny took me to healthcare, and that was around developing components for MRI machines and CT scanners. And post that, I also got an opportunity to work in the service industry, which is retail, and I set up a chain of cinema theaters. And then I have also worked in technology, and I have seen how the human connections can be made simpler by technology. And combining the three, we can do things that were not previously possible. And that's how the journey, the destiny has kind of led me to MardaMed.
So, see, when you think of healthcare, right, everybody thinks of a big hospital, but this is inside a mall. How did you come up with that idea?
So the idea came to me just like how we want to bring healthcare to people rather than taking people to healthcare. And that's where, if you figure out in city like Bengaluru, where do people go? What do you do when you want to have leisure time with your family? You go to a mall. You go there to shop, to watch movies, for your weekend activities. So why not take care of healthcare there itself? You don't need to make an extra trip. You don't need to worry about how the environment is going to be. It's a familiar place, it's a happy environment, it's a relaxed point. So that gels well with the position and the location. And that's how the idea came about, that let's repurpose spaces in a mall that are being vacated by traditional retail because of e-commerce, And so let's make those spaces purposeful in healthcare.
And does it also kind of make healthcare a little less scary for people who are intimidated by big hospital buildings?
Yes, of course. First they are curious. Second, they feel it's a familiar surrounding, familiar area. I can convince my kid to go to a mall rather than go to a doctor. And so it makes it a little bit easy, and that reduces the friction, which helps us take care of health as a routine.
So when somebody visits MardaMed for the first time, what can they expect?
They can expect that they will be heard. They can expect that they will be treated with courtesy, with compassion, and that their interest will be at the center of the entire experience. That's something they can expect.
What exactly does MardaMed have that's different and unique from other clinics?
It doesn't look like a clinic or a hospital to begin with. And then we put patient first and patient at the center of our experience. So the nurses come to the patient, the doctors come to the patient, and there is a follow-up and continuity, so that the issue that the patient came with or the check that they need to get done, we follow through and deliver what they came for. So it should become a one-stop place that I go there and they'll take care of me. That's what we want.
And any benefits for somebody who comes to your establishment?
The benefit is that they can rest assured that their best interest is at the heart of MardaMed, and that they have a trusted partner who would look after their interest, whether it is financial, whether it is health interest, whether it is an objective they want to achieve. It is at the center of what we do.
From idea to ideation, how is the journey like, and were there any challenges also along the way?
Of course, it's an entrepreneur's journey. So one day you're riding really high, and one day you're wondering why you started it all. So we've gone through this journey quite a bit. The idea began about 4 years ago. It has taken us exploring around the country, different malls, different spaces where we can house an MRI machine. How do we bring it in? How do we finance the MRI machine? And how does the center look like? How do we set it up? And even working with the mall developers, getting a space that's 15,000 square foot so that we can house all of the facilities that we bring in and we want to bring into the center. Developing the technology. How do we envision a consultation should go, how the AI would transcribe it, how to build it together, all of the pieces. So on multiple fronts, it has taken a lot of effort, and I'm happy to see the outcome.
Also, I did see something quite interesting, that each room in your clinic also has different names like Hope, Peace and Calm. How did you come with that idea?
Yeah, so if traditionally in India, doctors have their names written on the rooms, and then patients are taken to those specific departments or those specific providers, and then they are made to go from one door to another to another to another. Here our thought is that when a patient comes, we put them in the room for that visit, that becomes their room. How do we want them to feel is how we have named our rooms. And then within the rooms, we want the nursing staff to come for pre-consultation, explain things to them so that the anxiety goes down, they know what to expect. Then the doctor is already prepared. Until then, all of the information that is captured is available to the doctor. They review it, they come in, and then they explain things. And even after they have left, because of the intimidation that people face many a times talking to a doctor, if they forgot to ask any question, or if they felt that they have not understood, the nursing staff again comes back post consultation to make sure that you have understood what you have discussed, or if there are any questions, we can go back and bring the doctor back in. So the room belongs to the person, to the patient, and it is their center. And that's how we came about, and how we want them to feel is how we have named our rooms. Especially I'm proud of the dental room, which is called Smile.
So like that is something that's a little less scary than the drill machines and everything, yeah.
Yes, and you can catch up on your favorite TV show while you get your dental treatment.
But also the interiors look very cheerful, and it's a pop of color when you look at it compared to the other hospitals. They just maintain a generic color. That again was intentional.
Yes. Yeah, we got the designers that have done cinema designs and that have done happy places designs, and got them to work hand in hand with people that have designed hospitals, large facilities, and that have worked with the malls. Because when you go into a running mall, you have to abide by the constraints that the mall puts, as well as you have to take care of the tenants adjacent to you, below you, above you, and so you're plugging into that space. So the design had to go through a lot of iterations, and I'm happy with the outcome, how it looks like and how it makes people feel.
So, you know, you come from a tech background, right? And you were talking about the subscription model that you've brought in. Can you tell us a little bit about that? And you've kind of also made it a little fun in a way, that with the reward system and stuff. So,
yeah, the subscription is a happy balance between pay per service, wherein they'll charge you for changing your bed sheet as well, or the other side is the government model, where you've done your dues, paid your taxes, and the government will take care of. Worldwide, both of these models have had their flaws. It's very similar to how the retail industry works, that either you pay for every single thing that you buy, or you have a Prime subscription, or you have a membership subscription, and then that takes care of making sure that you will get goods at reasonable prices. So very similarly in the healthcare, the subscription model kind of aligns the interest of the provider and the patient to make sure that the best outcome is in both interests. So for example, when you have a subscription, you don't have to worry about consulting with a doctor, adding to your financial stress. So you just come to our facility, it's included in your subscription, one per month, so don't abuse it. And so every month you get one consultation added, and you want to consume it. Just like how, let's say, a subscription that makes you read books, if a book is added every month, you will make sure that you finish it before the end of the month. So then you don't postpone taking care of your health. And so that kind of aligns the interest.
so ultimately it is about making healthcare not look that intimidating and scary for people, right? But apart from this, what other things can maybe somebody do so that they understand the importance of visiting a doctor at the right time?
Absolutely. And there is a saying in the Silicon Valley and in the tech world, measure what you want to achieve. So it starts with measurement. So let's start with as simple as every day you weigh yourself, every day you check your vitals, you check your blood pressure, and then see the trends, what is happening in your body. And not just you look at it, but your doctor also looks at it. And then you come up with a plan to get you the best health that you can achieve. And so that's how we want to even gamify the system. And by adding MardaMed Pulse points, you can technically avail a consultation for free just by logging in your points, your vitals every single day. For about 100 days, if you add that, you will get 1,000 points, 10 points each day. And then you can use those towards services or the even coffee shop that we have at MardaMed.
So it's like a reward-based subscription plan.
Yes.
Right. That's interesting. Actually, I haven't seen much of that anywhere else, especially in hospitals. I think we have that on apps, but not here. But also in a city like Bangalore, do you think because it's such a tech-forward city, something like this would actually make a difference?
I hope so, because Bangalore has young professionals who are both working, family that is consumed in work, or taking care of children becomes a chore as well. That where do you take them? You take them to the mall for the happy environment and such. And so that's how we have designed it, such that in your busy lifestyle, you don't have to waste half a day just for taking care of your health, getting your health check done. That should just happen in the flow of your routine. And that's why we are in the mall, so that when you come to the mall, get other things done, fine, the family is doing something else, you just step into MardaMed, get your health check done, be on your way.
So what facilities does MardaMed have? Because see, when you come to a mall, suddenly there could be an emergency, something that pops up. What facilities does MardaMed offer?
We have quite an exhaustive list of facility. So we want to be the healthcare hub wherein you just show up and you will be taken care of. So for example, we brought in an MRI machine in a running mall. That is the first time that has happened in the world, wherein a running mall, we opened its wall and brought in a 70-ton crane and lifted an MRI machine, which is a 6-ton magnet, put that in to the mall. And so all the way from MRI machine to coffee, everything is available in our facility that you can stop by, have a comfortable conversation with your doctor in a relaxed environment and be on your way.
So what kind of departments are there, and what about the support staff as well?
Yeah, we have departments ranging from mental health to women's health, radiology to pathology, pharmacy, and even 2 operating theaters. Now the support staff is super excited about this idea itself that we are in a mall. One, it's a happier environment than in a hospital. So just by being in the mall, they are happy. The second thing is, all of them are very service oriented. They derive their pleasure from treating people well and seeing people happy and seeing people do well or get what they want. And that's the type of support staff we have. I'm very proud of them.
And it does make a difference. The happier your staff is, the more at ease I think the patients would also be.
Yes, absolutely.
Right. So, you said that your dad was a doctor, and from then to now, technology has of course changed. How do you think healthcare looks like in the future? How does it simplify and integrate with a person's life?
So, we have used technology quite extensively. When you come for a consultation, we record the entire consultation with the consent of the patient, of course, and that transcription is fed into AI directly. And while the conversation is going on, you can see that, and it understands the difference between North Kannada accent and South Kannada as well. And when it shows the transcript, it also feeds it into AI. It gives you prescription advice that your doctor can ignore if it's going not as per what they think. But so far what we have seen is more than 99% accuracy in the AI suggestion. It even captures all of the notes, so doctors don't have to worry about logging and documenting and such. They can just have nice, candid, easy, fun conversation. And the AI is smart enough to ignore all the small talk and focus only on the related conversation and bring out the crux of the conversation. And then when you leave and you go back, you can check the entire conversation or the gist of it on your phone. It's available to you, not just to the doctor, but to you. And you can converse, you can chat with your doctor, you can ask a question. And of course, we don't want to overburden our doctors, but at the same time, first, there is a triage system that if it's a serious question, if it's something that you should be seeing a doctor right away, we will follow up that. But if it is a just simple question, our staff will ask the doctors and reply to you. So there is a continuity of care by which you are connected with the care provider.
Even if you're not there.
Yes. And the doctors close the case only when that issue is resolved, not when you have left the facility. That's the difference.
So follow-ups also happen like on a very platform-based interaction.
Absolutely. And in future, some of this may be taken over by an AI agent, because we as humans, we forget, we make mistakes. Computers are good at doing the mundane tasks that is given to them at massive scale. So that is where individualized medicine is where we are headed. Today, for example, segmentation happens, or a pill you can buy only as 50 milligram or 100 milligram or 500 milligram, because that's easy for manufacturer to make. Going forward, it will design a pill that is based on your body weight, your vitals, and that it will deliver to you. And those are the things that are enabled with technology.
But there's a lot of talk about how AI cannot replace human interaction, but there is always a possibility for it to work alongside each other and bring out the best in both, right?
Absolutely, and you can see it in action at MardaMed.
Bangalore again has a lot of healthcare providers, right? But the AI transcription, a lot of hospitals are also picking it up. So how do you think MardaMed changes things for Bangalore as a city?
Yeah, we are accelerating the transformation that is happening. So, of course, everyone has realized and they are utilizing well. It's something that we do well in India, is we adopt to technology relatively better than some other parts of the world. And that is where Bangalore is actually at the forefront. And it's great to see that others are also adapting, and we are accelerating that trend, and we want to take it further.
And all of these smaller things kind of also benefit a patient in the longer run, like the whole concept of your consultation not ending just with a visit. The whole idea, how did that come about?
So there are a number of books on this topic that I have been reading, and when people talk about their life, they will even get philosophical, and they will say, quote some of the movies even, to say that the life should be grand, not necessarily long. But if you fall ill and if you're contracted with serious disease, it's neither long nor grand. It's miserable, not just for yourself but also for your family. So taking care of your health in time not only improves quality of life, but what we call as health span, not just lifespan. And that's what we are after, is that people should live up to their full potential. And that is now possible with technology, with innovation, with life sciences, with AI, and along with that, our evolving use of AI, and human compassion should come back.
I think Healthspan is a new concept for quite a few of us here. But yeah, and how different is or advanced is healthcare in India compared to other places?
We have the best doctors. We have access relatively to some of the best technologies. But that still remains limited to people that are aware. If you want to go get your health taken care of, there are avenues that we provide, and India is not as restrictive as places where it's controlled by the government, but it's not completely laissez-faire affair either. So India strikes a relatively good balance. Can we do better? Of course we can. And that's where our effort is.
And what is the future of both healthcare and MardaMed look like?
So we're looking to be an omni-channel, omnipresent companion for you, that even if you go to another city, you can go to a MardaMed facility and you know that your records are there. They carry with you, and the doctor would have reviewed that. The AI would have summarized it and given the relevant information to the doctor so that they give you the right advice. And you can live confidently, live better, live healthier, and achieve things that you want to achieve. So we want your health to fit your life, to fit your life's objectives and goals. And that's what we look forward to.
Deepak, thank you so much for your wonderful insights. It was refreshing to know that healthcare is not something that everybody needs to be scared about, and it's as simple as going to a mall.
Thank you.
Thank you so much.